This video will demonstrate the collection of blood culture samples from a central line with one port while minimizing the risks for both contamination and over or underfill of bottles. Per policy, if a central line is present on admission, blood cultures must be drawn within 2 calendar days of admission. Note that day 1 starts at the time of admission. 2 of the listed criteria must be fulfilled. Nephrology should be consulted with for dialysis patients with a dialysis line that's present on admission. If blood cultures are being drawn from a central line, a peripheral set must be drawn as well. If a central line has more than one lumen, a set of cultures should be drawn from each. For example, 6 bottles would be needed for a triple lumen line. Before getting started, gather all supplies such as clean gloves, a new sterile hub for each lumen, normal saline flushes, swab caps, alcohol swabs, an aerobic and anaerobic blood culture bottle for each lumen, a 20 ml syringe for each set of blood cultures, and a blood transfer device for each set of cultures. The volume of blood in each culture bottle is key and needs to be in the range of 8 to 10 milliliters per bottle. Using the 5 ml marks on the edge of the label as a guide, mark the fill line as close as possible to 8 milliliters above the broth meniscus level. By marking at 8 milliliters, this will ensure that no overfill occurs. Overfilling leads to false positive results, which leads to increased testing, cost, and length of stay. Before starting, verify the patient identity by using 2 patient identifiers, name and date of birth. Verify with the armband and against the specimen labels. Be sure to explain the procedure to the patient. Remove the plastic caps from each bottle and wipe each with a new alcohol swab per bottle and allow to air dry. The air drying action is what is killing the bacteria that may be present on the bottles. Perform hand hygiene, don a mask, and apply a mask to the patient as well. Perform hand hygiene for a second time and don a pair of clean, non-sterile gloves. Place a sterile drape beneath the central line. Before drawing the blood cultures, change the hub of each lumen of the central line. This will decrease the possibility of drawing a contaminated sample. To do this, start by clamping the lumen if applicable. Not all central lines will have a clamp. Then, remove the hub. While holding the catheter to prevent contamination, vigorously scrub the lumen with an alcohol swab for 15 to 20 seconds. After allowing to air dry, connect the new sterile hub to the lumen. Obtain the 20 ml syringe using a new alcohol swab, scrub the new hub for 15 seconds, and allow to air dry. Attach the 20 milliliter syringe to the new hub and slowly withdraw 20 milliliters of blood. Carefully remove the syringe from the hub and attach to the blood transfer device. Place the blood transfer device over the neck of the upright aerobic bottle so that its stylet punctures the septum. Allow the vacuum to draw 8 milliliters of blood to the previously marked fill line. Use caution not to overfill more than 8 milliliters of blood. There is no regulator on the vacuum in the tube. Therefore, you will have to control the rate at which the blood flows in the bottles by slowing the syringe plunger. Remove the transfer device from the aerobic bottle and then fill the anaerobic bottle in the same manner, again using caution not to fill with more than 8 milliliters of blood. For each additional lumen sampled, use new supplies and repeat the previous steps. Use a separate set of blood culture bottles for each lumen sampled. Once complete with sampling, be sure to flush each lumen with 20 mL of normal saline with a pulsatile flush. Correct labeling of the bottles is important. Make sure to label them at the patient bedside to ensure proper patient identification. Be sure not to place a label over the barcode or cover the area where the blood and fluid are visible. This can cause delays in result time. Be sure to mark each lab label with the date, time, your initials, and the location of the draw. For example, for my central line, you would write blood culture, central line, from which port it was drawn, the date, time, and your initials.